Good evening, everyone. For those of you joining us from the United States, happy Thanksgiving. And for those of you elsewhere who are joining us on this International Day for the Elimination of Violence Against Women, I want to start by saying that let us all unite for this cause, and all of us must play a part in ending violence against women. Let me welcome you to this second town hall put on by the Pan-Caribbean Partnership Against HIV and AIDS PANCAP on COVID-19 and vaccination, with a focus on children ages 5 to 11. My name is Dr. Rosamond Adams, and I'm the director of the Pan-Caribbean Partnership Against HIV and AIDS PANCAP. This evening's focus is to address concerns and to provide information on COVID-19 and vaccination, with a focus on children ages 5 to 11. Almost 2 years after COVID-19 was declared as a public health emergency of international concerns, we have seen the fluctuating dynamics of the virus. We have seen peaks, we have seen period of control, and we've seen further peaks taking us through what we have called the various waves of COVID-19. We have also seen the development of various vaccines and the rollout of these vaccines in order to reduce infections and to try to take us back to some level of normalcy. Unfortunately, we're not there yet. However, we know that there are many challenges with vaccines availability and acceptability, and therefore we're putting on these information sessions in order to share information, but also to hear your concerns and to answer questions that you may have with respect to vaccination and COVID-19. I also want to bring to you some of the recent statistics from the Caribbean region. According to the Caribbean Public Health Agency, CARPHA, and their latest COVID-19 situation report, the total number of confirmed cases in the Caribbean is over 2 million in 35 countries and territories, including 26 CARPHA member states. This new total represents a 0.6% increase in the number of confirmed cases to the previous reporting period and the previous situations report. There were 27,519 deaths recorded in the Caribbean region as of November 22nd, 2021, and the risk of further cases occurring in the Caribbean remains very high. CARPHA has advised that countries must continue to focus on interrupting viral transmission and reducing mortality associated with COVID-19. One of the topical issues around vaccination is that relates to going back to school. We know that children have been at home for a long time. Some of them have been taking classes virtually, but there is really a need for them to continue their education, because it's almost 2 years that a formal, systematic way of learning has been disrupted, and this has a potential of really putting this generation behind with respect to their learning. The region has not started to roll out as yet vaccines for ages 5 to 11, but the discussions around this has started, especially among policymakers, technical persons, and parents, asking a number of questions in terms of, should I vaccinate my child or not, that fall within this age group. This evening, we have 4 very experienced physicians who are with us to answer your questions. We previously had one town hall addressing another age group that was well received, and we received a number of questions, and it was very interactive. So we're hoping that this evening's session is also very interactive. Before I introduce you to the 4 panelists that we have, and I'll ask them to also turn on their cameras so that you can see them, I just want to draw your attention to a few housekeeping matters. Your mics are muted. We will have a questions and answer segment, And at that time, you may raise your hand using the raise hand icon, and we'll recognize you and we'll call on you. You can unmute and then you can ask your questions or you can make your comments. I will also like to inform you that this session is also being streamed live on Facebook, and you can also make your comments and ask your questions there, and our moderator will then send the questions to us, and we can then put the questions to our esteemed panelists. Let me now introduce you to our panelists. We have with us this evening Dr. Narendra Singh. Dr. Narendra Singh is a pediatrician. He is also a neonatologist and he is an intensivist. Dr. Singh is also a fellow of the American Academy of Pediatrics and the American College of Critical Care Medicine. He was the director of the Pediatric Intensive Care Unit at the Children's Hospital of Western Ontario, and later the Chief of Pediatrics at Humber River Hospital. He also has appointments as an Associate Clinical Professor at McMaster University, the University of Toronto, and Queen's University. He is currently the Program Director for the Pediatric Postgraduate Program at the University of Guyana and an External Examiner for the University of Guyana in the Undergraduate Medical Program. Welcome, Dr. Singh, and we're pleased to have you with us this evening. Our second panelist is Dr. Amar Singh. Dr. Amar Singh is currently an emergency medicine attending physician at the Hospital for Sick Children in Toronto, Canada. He recently finished his pediatric emergency fellowship and Masters of Clinical Investigative Sciences at the University of Louisville in Kentucky. Dr. Amar Singh, thank you very much for being with us once again. Our next panelist is Dr. Rajesh Bisnot. Dr. Rajesh Bisnot graduated from the New York Medical College. He is a general pediatric residency at the Westchester Medical Center and has been in pediatrics for the last 22 years at Eastchester Pediatric Medical Group, Boston Children Health Physician. Rajesh, thank you very much for being with us again this evening. And finally, we have with us Dr. Tonya Jerick. Dr. Jerick is a pediatric resident physician at the Joseph M. Sansari Hospital in New Jersey. She is an Advancing Inclusiveness in Medicine Education AIM Scholar at the Association of Pediatric Program Directors and serves as the resident delegate of the American Academy of Pediatrics. Thank you very much, Dr. Jerick, and it's a pleasure having you with us this evening. So we're going to move our conversation along, and we're going to start our discussions talking about the COVID-19 vaccination and an implication for children between the ages of 5 to 11. Dr. Singh, Narendra, I will start with you. Just confirming that you're hearing us.
Yes, I am.
Great, great. I'll start with you. I know that you work in intensive care. You're a pediatrician, many years of practicing pediatrics, and you're currently working with children. Can you please describe to us what you're currently seeing in your practice in relation to COVID-19, especially in younger children and the age group that we're looking at, ages 5 to 11? And tell us, how is COVID-19 affecting this younger group, and what are your recommendations in relation to the vaccine?
So I think it's important for parents to understand that despite the fact that it appears that COVID-19 does not affect kids in the same way as it affects adults in terms of numbers and severity, it still does affect kids quite a bit. And I work in a pediatric intensive care unit. So I do see kids who come in with COVID pneumonia. And over the last few months, I'm seeing a few more cases, particularly given the upswing in the Delta virus. I'm also seeing kids with multiple inflammatory syndrome, which is a syndrome that affects the heart and can get actually quite severe. I've had a number of kids that I've had to put on medications to support the heart until such time as the illness goes away. But what's happened as of the last month or two is that now that kids are back in school, we're not only seeing an upswing in COVID, but we're also seeing an upswing in other viruses that ordinarily come at this time of the year. So we're seeing kids with COVID plus RSV plus human metapneumovirus plus parainfluenza plus adenovirus. And some of them are actually getting multiple viruses. So when you add that on top of COVID, clearly you have a situation where kids are getting sick, more sick than they used to. So, I don't want parents to have the misconception that this is a very mild disease and it doesn't happen often in kids, because I do see it and I see the tip of the iceberg. And if you can prevent it by a good and effective and safe vaccine, I think parents should consider that. And I think as the discussion go tonight, we can answer more questions around the issue of safety of the vaccines, et cetera. So I would highly recommend it based upon what I'm seeing in the intensive care unit.
Great, thank you very much for that. We did conduct a poll at the beginning of our session, and 62% of the participants says that yes, they will give their children the vaccine. 4% says no, and 34% is saying maybe. So I'll put another question to you. So we have about 34% saying maybe. What can you say to these parents, considering what you're seeing, to convince them to go into that category where we are seeing 62% are saying yes, so that we can increase this to approximately 90-something% acceptability?
So there are a number of really good reasons to move that pendulum close to 100%. First and foremost, we have a vaccine that's very safe. There's a really good study out that's looked at 4,000 patients, of which 1,500 got placebos and 3,000 got the actual vaccine itself. And what they found is in excess of 90%, the vaccine was effective. When you look at the actual side effects, they were very minimal, local side effects, some systemic side effects like headaches, nausea, vomiting, muscle ache, all of which were self-limiting, and within a couple of days, they were gone. When you look at kids who do not get the vaccine, and one of the things that has been out there is that kids who have gotten the vaccine are developing this condition called myocarditis. And I have seen it primarily in adolescent boys after the second dose of the COVID vaccine. And I think it's really causing parents to give pause to whether they should give their kids that vaccine. But when you look at it relative to the myocarditis you see with COVID, the incidence of myocarditis with COVID is much, much higher than myocarditis secondary to the vaccine. So clearly the argument is you should be giving them the vaccine rather than allowing them to get this condition called MISC. But the other thing that's evolving in the last number of months is this situation in kids, which we're starting to see something called long COVID in kids, whereby kids are starting to have persistence of certain symptoms well in excess of 4 months. And depending upon the study that you look at, as much as 50% of kids they're finding may have actually symptoms 4 months after the fact. And symptoms include things like headache, confusion, dizziness, difficulty concentrating in school, right? So I think we really need to take that into consideration from a long-term point of view, because we don't know what's going to happen a year, 2 years, 5 years down the road in terms of the younger kids, in terms of the in terms of whether they're going to develop normally, whether they're going to have learning disabilities in school, et cetera. So I think the evidence so far clearly indicates that the vaccine is very safe. The disease, not so much, and the long-term effect of the disease, we're still learning more and more about it, and it can be quite devastating.
Great, thank you very much for that. And we're going to stick a pin with respect to the side effects, because I know that this is a question that many parents do have, and we will come back to address issues around the side effect. Dr. Jarek, just confirming that you're hearing.
Yes, I can hear.
Great, thank you very much. My next question is to you, that you're also working in the emergency department, that you're also seeing cases of COVID-19 in children in the emergency department. So my question to you is, what are you most concerned about seeing these cases, and what will be your message that you will share with parents in our audience this evening?
Sure. So what we're most concerned about when it comes to these cases is that now that children are starting to go back out to school, they're like Dr. Singh mentioned, they're being exposed to more viruses. And in our emergency department, it's very similar where patients are coming in not only with COVID, but with other multiple respiratory infections, and that is weakening their response to COVID itself. And so they're having longer hospital stays in general. Overall, my message would be, when available, that our children should get vaccinated. The vaccine has been shown to have 91% efficacy. And I think with such a high efficacy, it is definitely going to help decrease the amount of infection and disease burden in our population.
Great, thank you very much for that. I know that that it was mentioned previously, and you also alluded to it, that there are many other viruses that are going around, and children typically are in this age group will come down with common cold and some of these viruses. What will prompt a parent to bring this child in and suspect that it is possibly COVID-19 and not one of these viruses?
That's a good question. It's really hard to tell, right? The symptoms for COVID is similar to like the flu and all the other cold viruses. Things that we're seeing in our emergency department that triggers us or tells us more COVID than the regular flu is having like increased work of breathing, if they're having trouble catching their breath, if they're having persistent fevers and they're not really breaking. With COVID, we're seeing higher fevers. So 102 Fahrenheit and above usually more drives us to COVID. Some children are having like lack of smell or taste. And those are things that can send, us to think that it's COVID. Once there is an exposure, I know that we're having a lot of exposures of asymptomatic cases in schools, but if they've been exposed and they're still having flu-like symptoms, cough, congestion, anything like that, we would still be highly suspicious of COVID. So these would be things to look out for and to prompt your visit to the emergency room.
Great, thank you for that. Rajesh, I'm going to come over to you. I know that the rollout of a vaccine for children ages 5 to 11 has started in the US, and that you're engaged in this process. What is the experience like? And I'd like you to talk to us about the importance also of vaccination and link this to children going back to school. I know that their parents who are possibly saying that children may come down with the virus, but it's not affecting them as severe as adults. Should I just let them get the infection and live it out and get natural immunity? Or do you recommend that they're vaccinated to protect them against the virus?
Thank you, Rosman, and good evening, everybody, and happy Thanksgiving again to all. So being in general pediatrics, my experience in a general private pediatric office is a little bit different than Dr. Singh's and Dr. Jarrett. They're the ones who see the very acute cases, things like that. But in my office, statistically, after 22 years, this is the highest amount of patients we have been seeing in a winter. And this is, thankfully, we're not seeing a lot of COVID, and I'll get into that in a little bit. But the respiratory viruses, the metapneumonia viruses, your rhinoviruses are really doing a number on children. And as Tanya mentioned, you initially cannot just distinguish one from the other, but kids can get sick. Kids are getting sick. The vaccines were approved about 2 weeks ago for the 5 to 11-year-olds. The response in our office about a week and a half prior to that, when the buzz was going around in the media, we started to do a wait list to maybe get our logistics together. Within the first 2 days of opening that avenue to our patients, we had a 10% response immediately within 2 hours. We are currently, I don't know if it's a good or a bad thing, but right now, the response is overwhelming. We are looking whenever we can, we will be able to, or we will vaccinate at least 75% of that population in our practice within the next, we're hoping within the next 3 weeks. So, you know, many people will, like you said, the question about why to vaccinate if kids are not getting that sick. I think we've already launched past that with the previous two presenters. Kids do get sick. Kids may not die as often, but they will get sick. And as Dr. Singh mentioned, the long haul syndrome for children. I've been seeing that for over 16 months now. Children who are not being able to concentrate, constant headaches. And then there's physical effects. I have kids who are athletes that are no longer competitive because the virus causes an inflammatory process in every organ system in your body. We don't know how that will play out. And so far with vaccinating, we have vaccinated about 200 children in my office in the last 2 weeks. There's been no adverse or significant side effects reported, not even to the point of, you know, a fever. Most of the kids, it's just a pain at the injection site. You know, closer to home, my wife has 4 nieces and nephews who happen to be patients in my office, who are between the ages of 5 and 11, and they all got vaccinated last week. And to go a little further, my children who are 12 and 13 got vaccinated 3 days after the vaccine was approved in June. They're both girls. They've done well. It's been, what, 6-7 months and going strong, and it's made a difference to their lives, to them re-entering schools. They're both in the middle schools. Both of my kids play sports. They've been able to return to sports, soccer and track. All of their teammates, their classmates in the neighborhood that I live in are vaccinated. School has been going on for the better part of 3 months now, 2.5, 3 months. And I'm proud to say that our school district has not had to shut its doors. The vaccines are the most important tool in our toolbox to attack this whole pandemic. The vaccines are not the only thing that we should, you know, solely focus in. But like I said, it is the best preventative measure we have. They're safe, they're effective, and like I said, they work. And, you know, yeah, compared to December 2020, when the vaccines first showed up, yes, you know, naturally there was hesitancy. I would be lying if I didn't say, you know, the millisecond before the needle went into my daughter's arms, that as a dad, I didn't kind of like step back a little bit. But you know what? I trusted in the science. I trust in what I do. And, you know, at the end of the day, there was no hesitation for myself and for those around me. And it's worked. Like I said, school districts, I happen to live and work in a, you know, a county, which Westchester County in New York has the population size of basically Guyana. It's about 700 to 800,000 people. As a county, we're about 86% fully vaccinated. You know, children ages 12 and up, I think we're approaching about 53% fully vaccinated. In the US thus far, I think 3 weeks into the 5 to 11-year-old, over 1 million children have been vaccinated already, and the rollout has barely been a week and a half now. I think some of you may have read or seen in the news in the New York City schools where they did pop-up vaccine sites at the schools. They actually ran out of vaccines because the response was overwhelming. And, you know, given the little poll that was mentioned, we talked about some 60% of you said you would give the vaccine. That shows, I think, I mean, first of all, the fact that you're on this webinar, this town hall, is brilliant because you are attempting to educate yourself, and hopefully those of us that are on here can give you that confidence as sources, as trusted, reliable sources. And like I said, I am doing it. I am doing it in my office, and I'm seeing the results. Like I said, my older daughter plays soccer on a club team, and she plays for her school. We have not had a disruption. As parents, we are allowed to go watch the games. My younger one runs track, and now track is going to be indoor. The indoor facilities are open. A year ago, they weren't. My daughter is only allowed to go because she is vaccinated. And so in schools, it's a huge part of the toolkit that we should employ. You know, some of the other things are masking. Masking is not going to go away. We shouldn't.
We're gonna come back to masking, and we're
Okay.
gonna come back to these other preventative measures. But one of the questions that we have in the chat is, and I know that you are taking part in, you know, in the vaccination efforts and so forth, is what vaccines are currently available for children ages 5 to 11? Is it the same as the adults, or is it specific vaccines that are available for this age group?
So the vaccine that's available for 5 to 11 is the Pfizer vaccine only. It differs from the adult vaccine in that it's a smaller dose. It's about a third of the dose from the adult vaccines. The adult vaccines, I think, is 30 micrograms, and the 5 to 11 age group, it's 10 micrograms. There's also the preparation of the vaccine is slightly different on what's called the buffer of the vaccine, or the molecules, which essentially is what helps to stabilize the product. And as a result, compared to the initial adult offering of the vaccine for 5 to 11-year-old is much, much more stable at regular fridge temperatures or freezer temperatures that most doctors' offices have. You don't have to have these, you know, very specialized ultra cold storage appliances.
Great. Thank you very much for that. Amar, you're also a practicing physician. I'm sure that you're seeing cases where you're practicing. I think all of the previous speakers spoke about these other viruses that are currently going around and the correlation with winter and COVID-19. My question to you is, what are you currently seeing? And I know Rajesh would have spoken about the high rates of vaccination. Is it that you're also seeing high rates of vaccination? And if so, what strategies can be used to translate this into the Caribbean when we start rolling out vaccines for children ages 5 to 11?
Thanks for the question, Rosman. So I think, you know, from what I've seen in my experience, I work in a pretty busy emergency department, a pediatric emergency department in downtown Toronto. So we're seeing a lot of respiratory cases. And in terms of differentiating between, you know, flu, the different metapneumoviruses, and COVID, you can't really do that based on your physical exam alone. So we do need to do testing to figure out whether it's COVID or not. But the most common symptoms that I'm seeing are runny nose, fever, and cough. And just given that we have such a low threshold to do testing in the emergency department, I'm also seeing a lot of asymptomatic patients. I'm also seeing a lot of patients with abdominal symptoms. So the symptoms do vary quite a bit in its presentation. And then it varies a lot in terms of severity as well. You know, kids can get just runny nose, cough, fever, the typical cold symptoms. They can get MIS-C, which can be pretty severe. And then they can also need respiratory support. And predicting who those kids are is extremely difficult to do, which is why it's so important for us to get control of this virus. And then, you know, to parents, I'll say, you know, just when you know, your kid is having any symptom at all, whether it's runny nose, whether it's fever, whether it's a cough, abdominal pain, vomiting, it's really important, especially if they're not vaccinated, to just keep them as isolated as possible. Try to avoid contact with anyone or anyone that's at high risk specifically. Really getting vaccinated is, you know, our only long-term plan to overcome this pandemic. We can mask, we can wash our hands. Those are all really, really important in terms of controlling the spread of this virus. But when it comes to really getting over this pandemic, we need to vaccinate as many people as possible. And the evidence shows it's safe. And I think, you know, as a parent myself, it was important for me to be well informed, to make informed decisions, look at the research, look at the data, which I've done in quite a bit of detail. And, you know, I have two very young kids. I have a 2.5-year-old and a 9-month-old. And as soon as the vaccination rollout comes for that age group, I'll be the first person in line with both of my kids to get it done because of what I've seen.
Great. Thank you.
Does that answer your question?
Yes, and yes, I'll come back to you. Now, there's a question that I have for you. If a child is 11, should a parent wait for them to turn 12 so that they can receive the dose for that age group, or should they be vaccinated immediately?
That's a really, really good question. And I think it depends on whether they're going to turn 12 in a week or it's going to be a number of months. So my suggestion would be to get the dose, get the vaccine as quickly as possible. And if 3 weeks later they turn 12, they'll get the 30 microgram dose. But if they're still within the 11-year age group, after 3 weeks, then they should get the lower dose at 10 micrograms, right? One of the interesting things we found that when they drop the dose less than 12 years of age, the complication rate is much less, right, in that age group, as opposed to above 12 years of age. So the question is, would a dose of 10 micrograms at 12 or 13 and 14 would still be just as effective? And we really don't know that. I think they're studying the dose benefit ratio at the moment. But so to a short answer to the question is that they should get it immediately as soon as it becomes available, both doses within 3 weeks.
Great. Rajesh,
I wanted to add a little bit to that, if that's
yes,
okay.
go ahead, Tonya.
Yeah, I just wanted to add that the FDA advisory committee did do dose phasing testing on the Pfizer vaccine for 5 to 11 years old. So they do know that 10 micrograms dose is definitely giving an appropriate response, a protective response in those kiddos. So it's okay that it's a lower dose. It would still be effective.
Great.
But what they've also found, which is really interesting, Tanya, is that the amount of febrile reaction that they get with the smaller dose and the amount of side effects is actually much less than the older population.
That, yeah.
So that the side effects seem to be somewhat dose dependent. So it's a good thing. Give them the smaller dose. It's just as effective.
Great, and I'm going to come to side effects because there are a lot of questions around side effects in a while. But Rajesh, I'm coming back to you because you mentioned COVID long COVID, and there are a number of questions that are coming in with respect to what exactly is long COVID. How do you know it is long COVID, and what do you look for? And are there any, and anything that parents should really be concerned about if they develop long COVID?
So yeah, long COVID is basically, the term coined, as we were learning more and more about this disease, it was basically the symptoms that persisted beyond the immediate infectious period. So the immediate infectious period, we kind of ratcheted down to, from the day of infection to about 10, 14 days, things like fever, cough, chills, body aches. And then that resolved, thankfully, for most children anyhow. And they seem to be better and move on. And that would happen for most children. However, there's a significant amount of children and adults, by the way, that we see. And in the early days of the pandemic, I saw this more with our adolescent, or young teenagers. And the long COVID was essentially what the kids would come in and describe what's called a brain fog. And we would be like, okay. But then as the data start to be put together and realize that this is not an arbitrary symptom. This was actually a chronic side effect of the disease. And kids were complaining of anything from persistent headaches to simply not being able to concentrate properly. And it affected their sleep, ability to study, ability to read, anything that involves concentration. And that's one of the more common ones I see. Obviously, a lot of us are familiar with the loss of taste and smell. These are all, neurological consequences of this disease. Like I said, it wasn't just the neurological system that was affected, not just the brain. Every organ system seemed to be affected. But in children, the other one that I really saw a lot too was, with body aches and muscles. Like I said, I've had quite a few kids who are athletes that literally came in and said they're broken. A girl who is a track star simply can't do the things she's doing. We know that COVID affects the lung and the pulmonary system a lot. And the, initial CAT scans out of Europe, especially Italy, showed persistent loss of lung function over, the disease. But yeah, the long COVID is a very significant consequence of COVID infections. And, seems like, yeah, it might be months, but, I still have children. We're looking at a year down the road. And now more and more, we in the pediatric community where I am, we've actually, my medical center actually has a long COVID clinic, and they're trying to study and help these kids. And, just like everything else we're learning, are we treating this like, kids with concussions? And, now you're starting to have to recommend these children have reduced workloads, and, some of them simply cannot be sports, oriented. They just got to take it easy. But like I said, it's definitely an evolving process. There are things like COVID toes, rashes, on the tips of the fingers and toes. I've seen kids who've lost their fingernails and toenails from it. Some kids, the hair are falling off. So there's long COVID, like I said, encompasses a lot of things. I think the one that that seems to be most significant is the neurological side effects. I actually had some kids with renal failure from COVID, but that might have been the immediate acute phase too. But yeah, these neurological side effects are definitely worrisome for anyone, much less a child who is still developing and growing.
Great, thank you. I know that now. Yes, go ahead.
Could I add a little bit to that? And I just want to amplify what Rajesh has said. There's some really good studies out right now that are looking at this long COVID, and it's becoming quite a significant entity. And some of the studies actually suggest that the long COVID is affecting between as many as 15 to 50% of kids. In other words, they continue to have persistent symptoms 4 months and beyond that, right? So Rajesh said there are clinics that are actually starting up right now that are essentially just looking after these kids with chronic COVID disease. There's one in Montreal that's starting up. And as a matter of fact, and I put it just on the chat line, there's a website called longcovidcanada.ca, which is actually a support group for parents and kids with long COVID syndrome. And the reason I put that up is just to impress upon the viewers and the parents who want to make that decision that this is a real phenomenon. And we're seeing it, and this is going to be a long term, and it's going to be a chronic disease. And a lot of the kids, when they look retrospectively, what they found was these kids did not have severe COVID disease. Many of them had very mild disease. But despite the fact that they had mild disease, many of them are still developing this long COVID syndromes. And they've actually started doing studies in school right now. And a lot of these kids are actually starting to have learning disabilities and inability to concentrate in school. And it's affecting them as well academically. These are not things you're going to see on day one, but these are things potentially you're going to see long term and down the road. So it is a huge phenomenon. And I'm an intensivist. I don't do much in the way of developmental pediatrics, but clearly there is, this is an entity that we need to be aware of, and it's definitely a thing. Thank you, Rob.
Yeah, and I asked about that because there is, the thought that the people are hesitant in taking the vaccines because they don't know what will happen in the long term. But we know for sure that as you said, children who have become infected and not even severe infection, just from mild infection, are developing long COVID, which has the potential to impact them even longer in their growth and development. Tonya, I know that children in this age group are generally in the phase in which they should receive their regular vaccines. What will you say to parents who may have concerns about them receiving their routine vaccination and taking the COVID-19 vaccines? Can they do that?
Yes, so the current recommendations is that they can get both vaccines at the same time. Just it's recommended to have it at different sites. Usually when it comes to routine immunization schedule, what they do are called concomitant studies, where they would usually test this vaccine against the vaccines that the children are supposed to get and see whether or not it has wavering effect on the other vaccines. Like one of my senior physicians always say, we're building the plane as it's in the air. So those studies have not been done with the COVID vaccine and the routine immunizations, but the current recommendation is that they can still get both. In the event that COVID becomes something that becomes a routine vaccine and it has to be added to the schedule, I anticipate at that time they would do actual studies for it.
Great, thank you for that. Amma, I know that it may be difficult for children to continue wearing their masks when they're at school. You send them back to school, they're all socializing. Their mask can slip off and they may not put it back on and so forth. And so the question that parents may be asking is, if my child is vaccinated and they're going back into the school environment, should they wear face masks all the time? I know that hand hygiene, we have to instill on doing this. So they need to wash their hands all the time, use hand sanitizers, but if the constant wearing of the face mask, what do you recommend, or what are the recommendations around this as they go back into the school environment? They're in a classroom with maybe 15, 20 children.
So I think as long as there are some guidelines that exist about people that are vaccinated being in if everyone is fully vaccinated, if there are no symptoms, it's okay to remove masks. With kids right now, it's very, very difficult because a lot of them are not going to be vaccinated. So my recommendation at this point would be to continue wearing masks. I understand as a parent how difficult it is to keep a mask on a young child. But some of the things you can try to do as a parent are, wear the mask, practice wearing the mask at home. With my older 2.5-year-old, we did practice, for 15-20 minutes a day. Initially, it was really, really tough to do. But as he got used to wearing it, it became easier. So right now, I think it's important for kids and everyone when they're out in public, vaccinated or not, to continue wearing masks in those smaller settings, where it's between family and we can ensure everyone's vaccinated and no one's symptomatic. It may be okay to remove the mask, but in large areas, especially in areas that we anticipate the virus can spread, like schools, it's important to continue to wear the mask.
Great, thanks for that. Now I have a question for you that is in the chat from a parent. If the child has a severe reaction, such as anaphylaxis to a particular COVID-19 vaccine, is it safe to take a different COVID-19 vaccine?
I guess my question is going to go back to, I have yet to see a severe reaction to the Pfizer vaccine or any of the other ones. But I think it's important to examine clearly what was the ingredient in that particular vaccine that they were allergic to. And I would refer that individual to an allergist to identify exactly what it is, to ensure that the next vaccine does not have that active ingredient. So it should be done in a systematic way. So to say if you got Pfizer and you had a reaction, should you use another one? Or I think it would be premature to say that. I think you need to be vaccine specific, identify exactly what the ingredient is, and then figure out which vaccine would be safe to use at that point in time.
Right, because it may not be that the allergic reaction or the severe reaction is due to the vaccine as a whole, but maybe a specific ingredient that is in that vaccine. Good.
And that's generally the case, Rosman. It's usually an active ingredient that's in the vaccine that preserves the vaccine that they're allergic to, as opposed to the actual active ingredient itself.
Great, and it's very good to know that, because I think that there are some other questions that are coming up, asking if does the Pfizer BioNTech vaccine contain animal-based ingredients, and so forth. So questions will come up with respect to the ingredients and allergies. Rajesh, I have a question. There's a question that we receive online. Do you anticipate that children will require booster shots, or is it too early to determine this? Because we know that we're speaking now about booster for adults, and so will children be required in the future to receive booster shots?
So yeah, I mean, I think it's a little bit premature to look at that, but I mean, I think we're at the point, 2 years down the road with this. COVID-19 is we're not going to eradicate the virus from the face of the earth. We will have to kind of learn to live with it. And like I said, we're here discussing vaccines, which is probably the best approach to help protect ourselves. As such, if I were a betting person, I would say yes. We would probably require, boosters that would resemble, your yearly flu shots, maybe every other year. It's a big thing to try to vaccinate the whole planet to get to that herd immunity, and it just seems like we're not getting there fast enough. But if I were, to try to be, put on my, betting hat, I would say yes. I can anticipate booster vaccines maybe on a yearly basis, certainly maybe every other year. But, I truly hope that we don't get to that point, but I don't think, I think we have missed the window for eradication of the virus.
Thanks. Amar, one of the question is that I vaccinated my child and my child has come down with a fever. Should I be overly concerned? Is this, is this an adverse reaction to the vaccine? And should I, not give my other children this because they've gotten a fever, they've been irritable all night?
So that's an excellent question. When I got the vaccine, and I got both doses, both times I had a fever. Both times I had a fever over 38.5. And I was happy because I knew that my immune system was recognizing that, and potentially building antibodies and reacting to the vaccine in a positive way. So look, I know what it's like to have a child with a fever. It's concerning. But when it comes to having that specific reaction, having a fever after the vaccination, it's hard to sell it as that's a good thing, but it's the body's immune system reacting in a positive way to the vaccine. So I wouldn't be concerned.
So you're in fact saying to the parents that if your child comes on with a fever, don't get overly worried. You should be worried,
Yes.
of course, because no one likes to have a fever, but do not get overly worried. What can they do in order to control this fever so that the child is, is comfortable?
Yeah, so treating fever, you can use antipyretics, so Tylenol or Advil, or acetaminophen, ibuprofen, Motrin are some common fever-reducing medications that you can use to help with the child's fussiness and to help with the temperature. But I wouldn't focus too much on bringing the number down. I would more focus on treating the child's discomfort and fussiness with the fever. So
since I may expect a fever, should I take these medication before vaccination? So I don't come down. Say that again. Since there's a possibility that I may come down with a fever, should I take medication before?
That's a good question. I've never really thought of that, to be completely honest with you.
Let me
I don't go ahead.
Since I in practice where basically as general pediatricians, that's all we do, but I generally try to advise my patients not to pre-medicate. Some of them do it anyhow. I mean, listen, you win some, you lose some, but as with particular focus on the 5 to 11-year-olds, like I said, we have given, I think, over 150 doses in my personal practice. I think within my company, which we will share those statistics on Monday, it's probably close to about 5,000-6,000 doses have been given, and we have an active reporting system within our company, so that God forbid, should there be a concerning reaction, we can immediately alert all of the pediatricians right away. But as far even with those 150 doses that have been administered in my practice, we have been actively following up with our patients at 24 and 48 hours, and there's been really no symptoms reported, not even the fever. The most common thing, like I said, some of the kids will complain that, oh, my arm is still sore, but thankfully at this point, not even the fevers.
Great. Thanks for that. Now, if a child is tested positive for COVID-19 and or has COVID-19 antibodies, do they still need to be vaccinated, and how long should you wait before they can be administered the vaccine?
That's a really, really good question. And there have been some guidelines that have come out in Canada that said they should wait about 3 months after they've actually gotten the active disease. So 3 months after, it is recommended, because what we do know is that despite the fact that you've gotten the active disease, the immunity does wane as well. So you need to actually augment the immunity with the booster shot, and it is recommended that you get both the doses as well. So it's recommended 3 months out that they should get the vaccine, despite the fact that they've gotten it.
Right, and as a follow-up question, I think this should have come before the one that I just asked you, and I think we did speak to this before, but a parent want to know, is it better for a child to get natural immunity to COVID-19? And you spoke about natural immunity and that is waning, rather than immunity from the vaccines.
That's a really good question, and I actually saw that question on the chat, and I thought about it, and I said, you know what, if it makes sense to get natural immunity, and natural immunity is just as good, then by all means go ahead and get it. But what we're finding right now is that if you got the COVID disease, the acute effects of COVID, which I see in the intensive care units, which is MISC or COVID pneumonia, right? It's definitely a reality, right? If you got the disease. And then this COVID, this long COVID that we're seeing right now, which is evolving into a completely new entity altogether. So, you know, to answer the question, it's probably better you get the vaccine rather than get the disease, because there's so many other acute and long-term effects of the disease, and not just the immunity, it's the actual disease itself that you need to be concerned about. And therefore, the answer to the question is, please do not let your kid get natural immunity. Please get the vaccine. The disease is horrible, and the long-term effects is just coming to light right now. We're very concerned about that.
Great. And a very important question as a follow-up to that, Rajesh, and I'll ask you this. What is the parent is asking, you know, what's the worst side effect from vaccination compared to a kid who has gotten the disease? And possibly, I guess it's the way, you know, do I let my child get the infection, and or should I vaccinate my child? What are some of the side effects that you're seeing? I know that you spoke earlier to long COVID. I know that you also spoke to, you know, the myocarditis and so forth. But what are some of the other complications that you're seeing from, say, possibly side effects from the vaccines or complications from the disease itself?
Right. So, you know, I think Nar just spoke a little bit more about, you know, the unpredictability of this virus and the infection and the illnesses that we're seeing in children. You know, I think there's, you know, we can all play with statistics and you know, this pandemic and this disease has been studied more than any other thing on the planet this last 2 years. Everybody has become a virologist and an epidemiologist out of nowhere. You know, social media is a go-to source, but the problem is kids are getting sick. Those of us on this panel who see it, it's 100% every single day. You know, it's not an arbitrary statistic. It's not a, you know, I saw one alluded to in the chat that we're all in North America, and you know, we do have a little bit more resources here in the US, and certainly even here in New York where I am, there can be such disparity in terms of access. But I don't think any parent want to see their child sick, end up in emergency rooms, end up in ICUs, and end up dead, or with strokes, with, you know, chronic debilitating disease. The vaccine and what we are seeing now, we're looking at the, you know, the subsequent waves of COVID infection. Hospitals and emergency rooms are overwhelmingly being filled by unvaccinated children and adults. So that, you know, certainly compared to December when the vaccine was very, very new, and we've had the opportunity to study it in real time, several billion doses of the vaccine being administered across the planet, and the side effects being, the risk of getting the vaccine is far outweighed, by the benefits, and versus, like I said, getting the disease. While most children, yes, will be pointed out, most children will get a mild disease. It's very unpredictable where that can go on. A child who contracts COVID and is asthmatic or diabetic or has an other underlying chronic condition, or gets, rhinovirus on top of COVID and, your human metapneumonia, any other thing, then their vulnerability goes up even that much more exponentially. So yes, the very few side effects that we have encountered with given the vaccines, the efficacy and safety far outweighs getting ill from the disease. And then, we'll take it a step further in terms of, you look at some of the other things like schools and things like that, all right, so here in the US, a kid gets a fever and a cold, they get kicked out of school. They need to come to the doctor, get cleared. Now, that kid, by the time they get back the COVID test results or they get better, they would have missed half of the school week already, if not the whole school week. Think of this happening now every 2 weeks. You're going to miss the third of your class time, and it becomes disruptive to the class and the school. So yes, it's, and I really want to emphasize that, some people will have to think, well, if you vaccinate your kid, then I don't need to vaccinate mine, right? But frankly, that is a very selfish approach, right? We're all in this together. It has to work as a, as a mass, as a herd going forward to make it better for everyone. Otherwise, we'll just be spinning our wheels with.
Yeah, because I guess if we all think that way and we all wait for someone to to do it, we will never get to getting everyone vaccinated. Now I see that you have your hand up.
Rosman, I really wanted to add to that, because I want to give the folks on the line a little bit of perspective for what I see in the intensive care unit, because the question was the complications of the vaccine versus the complications of the disease, and I have seen them both. In the last year and a half since the onset of this COVID in kids, I've seen close to 10 kids with MIS-C. Of the 10 kids, I've had to put one on a respirator. Of the 10 kids, 5 of them required medicines called inotropes to support their blood pressure, right? This is pretty significant disease. None of these patients fortunately died, they recovered. In the last year and a half, I saw one kid with myocarditis secondary to the vaccine. Within 2 days, he went home. He didn't require any supportive therapy. He required some analgesia, and he went home. When you look at the complication rate from the vaccine versus myocarditis from COVID, it is much, much, much less with the vaccine than it is with COVID. And COVID myocarditis is much, much more serious. And I'm not saying this because I read this in a book. This is what I've seen in my intensive care unit, and I've looked after these patients. So you really have to put that in perspective in terms of the complications. And I know parents are worried about the myocarditis, but I have to tell you, the myocarditis from the vaccine is often seen in adolescents.
Not to stop you now, but what is the myocarditis? Because I'm sure some of the parents online are, they're probably hearing this word myocarditis, but what exactly is it and why should they be concerned about this?
Yeah, that's a good question. I apologize if there was an oversight on my part, but it's essentially an inflammation of the heart, right? That's caused by the virus, or it's caused also by post-vaccine. So kids get the second dose of the vaccine, and usually within a few days of the second dose of the vaccine, they get this inflammation of the heart, which is self-limiting and it goes away by itself. With MIS-C after with COVID, 3 or 4 weeks after COVID disease is then when they get this MIS-C, which is a much more serious disease. So essentially, myocarditis is an inflammation of the heart that can be actually quite serious. Clearly not as serious with the vaccine as it is with the COVID disease. And it's really, really important to understand that. So another question that there's something else that actually came on. How is the vaccine developed quickly? I hope you asked that question, please.
Yes, and while you have the mic, please go ahead, because we're going
Okay,
to open up. We're going to open up after this
Okay.
to the audience to ask their
So
question.
it's a really, really good question. And I think a lot of people out there are very hesitant to give their kids and give their family members the vaccine, because they said, you know what, we developed this vaccine within the last year. But historically, when you go back and you look from 2001, there was SARS that came out, and it was very prevalent here in Canada and in Toronto. So SARS that's called SARS-1. What we're seeing now with COVID is kind of like a SARS-2. So from 2001, they actually started developing a vaccine for SARS, all right? And much of the development of that vaccine went into developing this vaccine that's here. So this didn't just happen in the last year. This has been happening for the last almost 20 years in the development of this vaccine. So please don't go away by thinking that the vaccine was just developed in the last year. No. They built on the foundation of what they did with SARS-1, and that's why we came up with the vaccine so quickly, because this was in the pipeline being developed for many, many years before. So this is a very, very safe vaccine. And people also say, well, we did it really quickly in the last year. Well, it was done quickly because the vaccine didn't have any red flags to it, right? So sometimes when you start a vaccine, you run into a roadblock with a major problem. Then you take a step back and you modify it, and then you move ahead further. This does not happen with this vaccine because it was in the pipeline for 20 years. So it's really important to understand this is a safe vaccine. That's a lot of study has gone into it for 20 years.
Yes, thanks for that, because I think that when we look at, some of the reasons why people are hesitant towards receiving the vaccine, this always comes up as one of the concern, that the vaccine was developed too quickly. I don't know what will be, the side effects and so forth. So we're glad that you bring some perspective to this, that it was not developed overnight, that there were years of studies and clinical trials into the research and development of this vaccines. So thank you guys very much. We are going to open up now to our participants who are online. This is the opportunity that you have to speak directly to our panelists. We ask that you raise your hand. We will call on you, and you can unmute, and you can ask your questions. You can direct your questions to one of our panelists, or you can ask the question generally, and the panelists will decide who will take these questions. I know that there are some questions that were posted in the chat. Unfortunately, we were unable to answer all of them. And so if you did post your question in the chat, or your comments in the chat, and we were not able to answer them, this is not the time that you can also raise your hand and ask the questions. We also ask that after you finish asking your questions or give your comments, that you also lower your hands unless you do have another question to ask. So I'm going to start with Devike Rampasad. Please unmute and go ahead.
Good night, everyone. First of all, I'd like to thank you all for having this webinar with all of us. It is very informative, and I appreciate all the efforts. My question is about children with other comorbidities, because I am a doctor that works in the COVID ward. And even though I'm not directly involved in the treatment and care of pediatric children, I do see them. And most of the times they come in for different diagnoses and end up with COVID-19. So my question is, this vaccine, was it studied in children with other comorbidities like epilepsy, cardiac pathologies, and among others? And what were the results? Thank you.
Now, can you take that question?
Yeah, Devaki, that's a really good question. So when we looked at the study of 4,000 patients, they actually did not describe clearly whether or not they had any comorbid conditions. But what we do know is that when you look at hospital admissions in North America, of let's say if there were 100 kids that were admitted with COVID, 1/3 of them are actually normal kids with no more comorbid conditions. 2/3 of them have comorbid conditions. So the question is, should they be vaccinated? The answer is yes. Did that study describe clearly that those were part of that group? And I don't believe they did, right? But clearly, these kids should be vaccinated, and they should probably be first in the line to be vaccinated for COVID.
Great. Thank you very much. Jody, please unmute and go ahead.
Good evening, everyone, and thank you for a wonderful seminar and discussion. My name is Jody Swaby. I'm an internist in Guyana, and I was hoping that there would be commentary on whether it is okay to use the adult formulation, that's the purple vial, of the vaccine to vaccinate children 5 to 11, because as we know, we pretty much all of the territories have the adult formulation now. And there has been consideration about diluting the adult formulation to give children. But there have been advisories about this that I've seen from the CDC, et cetera, because this would require giving a very small volume of the adult vaccine, about 0.1 cc, I think is what I saw, which has not been tested to my knowledge for an IM dose. IM route of administration of a vaccine. So can anyone comment on this? Is this safe to do? Is it correct to do it? Or should we wait until we receive the orange vials?
Rajesh, can you take that?
Yeah, thank you, Jody. That's a phenomenal question. It was actually posed by our nurses at one point, and our infectious disease doctors who worked quite closely with the CDC. And so the answer was no. Do not use or dilute the adult formulation for the 5 to 11. Wait until you get the proper dosage. There seems to be much more than just the simple, strength or quantity that's involved.
Great.
And like I said, this is what they tested the vaccines on, the children on the studies.
Great. Thank you. Hanif, please unmute and go ahead.
Hi, good night all. Thank you very much. My question is in relation to, I'm calling in from Jamaica, and our government has stated that they're waiting, that they're not considering the vaccine because it hasn't been recommended by the World Health Organization yet. And that's kind of been their guiding principle on vaccine. So I wondered if you had any thoughts on that in terms of regional decision points should be, in your opinion, for when to allow this critical age group to kind of approach to the decision making.
Yes, I think you fell off somewhat. Nara, I don't know if you got the question. If so, I'm going to put it to you. Or should I repeat?
I heard fragments of the question. If he doesn't mind repeating, I would appreciate that.
Sure.
Yes, can you repeat? Yeah, you broke up some.
So our government in Jamaica has stated they're not considering vaccines for the 5 to 11 age group at this time because it's not a World Health Organization recommendation. And that's been their guiding principle, is to follow the WHO recommendations. So I was wondering what your thoughts were on kind of how regional government should be thinking about that decision in relation to vaccines for children 5 to 11.
Yeah, if I were advising the government, I certainly would not wait for the WHO to come out with their recommendations. I think there are enough other bodies out there that are making this recommendation, including the CDC, including the the Canadian health authorities, the American health authorities are doing this. So clearly, if I were advising Jamaica, I would certainly recommend that they start the vaccination in this age group as quickly as possible.
Yeah, just to mention that countries follow their their guidelines and certain organizations who do give them advice. And I guess in the case of Jamaica, it is the WHO. And I think that maybe, they're waiting for formal WHO approval, because you could imagine if they keep jumping from different as different vaccines become available, they go with different guidelines. So there's a possibility of following the standardized WHO approval and guidelines. But I think until it's approved by WHO, if that is the government policy, then we have to we have to respect it, and we're hoping that it gets approval soon from WHO.
Could I just add to that, Rosman, a little bit?
Yes, go ahead.
I agree with you. I agree with you partially, and I think if governments have these rigid approval policies, it's clinicians and physicians and healthcare providers within the country that need to push that agenda forward, to say, guys, should we be waiting for this? How long is that going to take? And maybe we should not be doing this in this particular situation. So there needs to be some flexibility, I believe, built into it.
Great, thank you. Thank you very much for that. Melanie, please unmute and go ahead.
Good night, everyone. I want to thank you for all the information, but my question is, if you have a 11-year-old and let's say within the 3 weeks, this 11-year-old will turn 12, should we wait until she turns 12 to give the vaccine? Or if so, what would be the dose for the second dose? Would she get the same amount or the amount for the 12-year-old?
Yeah, we did respond to this earlier, but now, and I think now did respond to it. Now I'm gonna ask you again to repeat it, because this seemed to be a concern of many of the parents who are online.
Yeah, I don't know what's recommended at the moment, but what I would suggest to you, as soon as you're able to get the vaccine to your kid, please do get it. And if the first dose is 0.3 and 3 weeks later, or if the first dose is less than 12 years of age, he gets 10 micrograms. And if when he or she turns 12, that's within the 3-week time period, then have them get the double dose.
Yeah, so the recommendation is exactly that.
Yeah.
Thank you.
You're welcome.
So cool. Please unmute and go ahead.
Hi, good night, everyone. And thank you guys for participating in the webinar, COVID-19 that threaten the world at present. So my question is that a child being administered the vaccine, what actually happens within that child's body? That's one question. And does the COVID-19 vaccine, does it change or interfere with the child's DNA? Thank you.
Great, thank you very much. Tonya, are you with us still? Okay, Amar, are you also with us? Okay, I guess that they fell off. So Rajesh, I'll ask you to take that question, because I know it's a question that that many parents are asking. When they vaccinate the child, what are the the implications in terms of development, growth, and so forth? Will it there's so many misinformation out there with respect to modification of genes, DNA, and so forth. So his two concerns are what happened when the vaccine is administered in terms of the effect on the body, and will it interfere with the child's DNA?
Right. So the what's given in the vaccine is what's called a mRNA. It's a messenger mRNA. It's a very tiny fragment that then uses your body's process to create a protein, which is called a spike protein, which is the identical protein that's present on the virus itself, the COVID virus. Your body then reacts to that spike protein to create antibodies. So this is a very natural process in your body. So essentially, the vaccine is evoking your own immune response against the virus without you actually getting the virus? And the simple answer to the second one, no, the vaccine does not interfere with your DNA.
Great, thank you very much for that. We have a few minutes remaining. Please indicate if you have any questions or comments by raising your hands. And now there is always a concern about children with specific conditions, and you often will hear, even in adults, that I have asthma, I am diabetic, I have cancer, I am autistic, or I do have sickle cell disease or heart problems or HIV and so forth, and I should not take the vaccine. What do you say to people who say that I have this condition and therefore I should not take the vaccine?
Well, I think if you look, let's examine the data carefully. If you look at hospital admissions for pediatric patients with COVID disease, both to the hospital plus as intensive care units, what they found is clearly that 2/3 of the admissions that come into the intensive care units are patients that have underlying conditions that you just described, which is the asthmatics, the kids with chronic lung disease, kids that are developmentally diabetics, particularly adolescent diabetics. They're the worst in my experience. And kids are immunocompromised, kids with leukemia and various forms of cancer. These are the ones that are. So if anything, those kids should be the ones that are first in line to get the vaccine, not last in line, because they're the ones that end up in hospital. They're the ones that get critically ill, and those are the ones that are going to end up on a respirator and die. So they should be the ones getting it first and foremost.
Great, thanks for that. And there is a question that just came in. Is it possible for a child to have an allergic reaction to the vaccine, say after 24 hours, probably a delayed reaction? Rajesh?
Yeah, I mean, it is possible, highly unlikely. The most, immediate hypersensitivity or reactions that we see generally happen within the first 24, honestly, generally within the first 4 hours or so. But certainly you can, children can get like a slight fever, chills, kind of like flu-like symptoms.
Great. Thank you very much. So we're coming to the end, folks. I'm seeing no other hands raised. There is a poll. Same repeat question that we asked at the beginning. We asked that you complete it for us. But as we wrap up, now I'm going to ask you in a few minutes for you to give some closing remarks and comments, and to encourage the parents out there. We saw in the initial poll that there was about 34-35% of parents who are maybe about giving the vaccine when it becomes available to us. And what do you say to these parents as a parting word, as a parent yourself, to encourage them to vaccinate their children?
So I think first of all, thanks for the opportunity to speak to this group this evening. It's been very positive and very interactive. In my practice, the kids that I see that get particularly sick, it's important that we try to prevent that as much as possible. What I see is the acute setting. What we're seeing down the road is kids developing COVID long haul. And clearly, this is a new entity. This is something that parents need to be fully aware of as they make an informed decision to provide the vaccine. But I also think parents have a responsibility to society as well. Because if they don't vaccinate their kids, it means that we don't approach herd immunity. What that means is that the virus is going to continue to perpetuate in society, is going to perpetuate in the community. And as the virus goes from person to person and keeps replicating, it's also going to mutate again. And if we don't stop the propagation of the virus, the mutation is going to continue. We may have a much more dangerous strain down the road, whereby the vaccine that we're given right now may not be effective. Fortunately, it's effective against the Delta virus, but it may not be quite as effective. And finally, in this age group of 5 to 11, it's even more important that parents vaccinate this age group, because all of the kids that I have seen with MIS-C are exactly in this age group, in the 5 to 11 age group. These are the ones that get the worst degree of cardiac disease and myocarditis. It's not the 11, 12, 13, 14. It is this age group that are the highest risk. So these are the ones that I should be lining up first to get the vaccine.
Great, thank you.
If I had kids at that age group, I'd be giving it to them.
Great, thank you very much, Na. Amar, as we wrap up this evening, what are your words of encouragement to the parents who are still, iffy about giving their children vaccines in this age group? And I must report that, as I'm asking you this question, we've repeated the poll. Initially, when we asked the question, we had 62% saying yes, that they will give their 5 to 11-year-old child a COVID-19 vaccine when it becomes available. And we've repeated it after an hour-and-a-half session. And what we're seeing is that 80% are now saying yes. And only 5% are saying no, and 15% are saying maybe. So we still have a significant numbers in a percentage in the maybe category. What do you say to them to tip them over to saying yes?
Yeah, it's a good question, and I'm glad that we were able to kind of convert some of those people who are on the fence about it, and maybe this did help shift some of them to being more confident in getting their kids vaccinated. Look, if I need something fixed, if I need my toilet fixed, I call a plumber. If there's issues with wiring, I call an electrician. When coming up with these really, really difficult decisions, vaccinations with healthcare in general, look to your leaders, look to physicians, look to the healthcare leaders, that you trust, to give you advice when it comes to this decision. There's a lot of misinformation out there. I see it every single day. I talk to patients, I talk to parents who are really, really, against getting vaccinated. And it's very difficult, as a physician, as someone who sees acute COVID and kids getting really, really sick from COVID, to try to convince them, that this vaccine is saving lives. It's going to continue to save lives. And until we get everyone on the same page, we're going to continue to struggle with the pandemic, and we're not going to get over it. So really look at us. Everyone on this panel, physicians. We're all vaccinated. All of our family members, I'm sure, are vaccinated, and those that aren't, I'm sure we've tried to convince them that it is the right move. So look to those people when you're having this issue to try to answer that very difficult question in terms of whether you should get vaccinated or not. And just understand that there's a lot of misinformation on the internet. I see it every day. I do. There's a lot of garbage on there. So really look to us, look to, your doctors, look to your pediatricians, your family physicians when making this decision. And I think most of us, the huge majority of us, are unified in this decision that we've looked at the data. We all need to adopt and get vaccinated. And our kids are being back in school. They're young. They require direct contact, obviously. They're going to, spread the virus if we don't get them vaccinated. It's really, really important that we do. So look to your healthcare leaders, look to your pediatricians, look to your family docs when making this very difficult decision. But choosing to get your child vaccinated is the right one. And as soon as the vaccine rollout comes for, my kids, I'm gonna be the first one to get them vaccinated.
Great. Thank you very much for that, Amar. And as you said, there's so much misinformation out there. We don't even have to go looking for it. It comes to us, and so it is very important for us to decide. Is this really validated information, or is it misinformation? Tonya, some parting words from you before we wrap up in terms of any encouragements and advice that you may have for the parents, especially those who are saying maybe, or those who are saying no. How do you, what do you say to them to encourage them to get their children vaccinated? And even there is probably some adults here who are not vaccinated also. How do we encourage them to be vaccinated?
Yeah, I echo the sentiments of everyone else. I think that as physicians and as experts in the field, as much as we're learning and growing and research is continuing, what we found right now is that the vaccine is safe and it's a much safer and better choice than the risk of having COVID. We've been seeing the effects of COVID. We're 2 years out from a pandemic. We're still in a pandemic, and we've not only seen the effects from a medical standpoint, but like we were discussing, children are being affected not only if they're sick and they have to be out of school, but the fact that school is not ongoing for them. And these are many different effects that we can have long-term on our children. So I think, my message would just be to get vaccinated. I think it's very important. The risk of COVID is a lot higher than the minimum risk that we know right now that the vaccine may have.
Great, thank you very much. And Rajesh, over to you. What do you say to the parents as we leave them to this evening?
Yeah, so once again, thank you for inviting me. And I gotta say, a huge shout out to the 100+ participants, parents. There were some physicians on here, but you took the time to get on there, to listen to us, educate yourself, ask questions. I think, if we had done that survey, 12 months ago, it would have been the inverse of the answers we've gotten today, right? So, I'm gonna drop my physician hat and as a dad and and as a parent, appeal, and give you the positive news. Like I said before, I live in a community here in New York that's about the size of the population size of Guyana. And because of robust vaccination rates from the adults on down, the masking, respect for each other with our social distancing and, minimize crowded spaces and crowds and things like that, we have moved to some level of normalcy. In our schools, our kids with sports and extracurricular activities, adults going and sitting in a restaurant, all the things that we like to do and we want to do, and it was made possible by just one simple intervention. And the safety and efficacy has spoken for itself. To the 80% of people who have replied in the positive, I will charge you, be ambassadors for the message. Speak to 2 or 3 of your brothers, sisters, co-workers, fellow parents. If you convince one of them, the cascade, and we saw this is what happened. Last December, even many doctors and nurses wanted no part of the vaccine. And then as they saw people taking it and, your arms didn't fall off, you didn't become magnetic and all of this garbage. But the inverse happened. You stayed safe and you progressed. You got ahead of the pandemic somewhat. So my parting words is, on this Thanksgiving Day, I'm thankful for the vaccine.
Great, thank you very much. And at this point, I'd like to thank all of you, the panelists. We had a very interactive, informative session this evening. I've seen some comments still coming in the chat. I've seen one asking, for a longer session, but unfortunately, we have to end this evening. I also like to thank all of you, the participants who joined us and continue to follow us. And also, as Rajesh said, to charge all of you to be ambassadors, to go out there and to convince those who are still having questions or concerns about taking the vaccines. And as Amar would have said, if there are any doubts, if there are any questions, go to the source, go to your healthcare provider, go to the validated information that are available where you can get correct and validated information so that you can make this informed decision. And personally, from myself as a parent, I also urge you to take into consideration the health of your children. And so before I close, I'd like to encourage you to join us tomorrow, Friday at 11 a.m. PANCAP has its regular webinar series that we generally put on a regular basis, and we'll be discussing their vaccines and people living with HIV. So those of you who are available tomorrow, we encourage you to join us in that webinar. You can find information on the webinar on our website, pancap.org. You can also find information on our Facebook account. You can also join us on Instagram and on Twitter and on YouTube. And I encourage you to like our pages and also to follow us, because we do share information there on a regular basis related to not only to HIV and AIDS, but also to other public health issues of concerns to the region. So thank you very much. Continue to be safe and have a good evening, everyone.